Hi, good afternoon. Welcome. My name is Julie Yerkes, and I'm the Community Engagement Lead for the Partnership at Drug Free New Hampshire. And thanks for joining us today on this Facebook Live, where we explore current prevention initiatives around the state of New Hampshire. This week, we're also celebrating National Prevention Week, which is a public education platform showcasing the work of communities and organizations across the country that are preventing substance use and promoting positive mental health. And that is sponsored by SAMHSA. And here at, you know, the Partnership at Drug Free New Hampshire, and that's what we do on these Facebook lives regularly, is really showcase the work of our partners and really try to elevate and make accessible and understandable sort of this wonderful world of prevention. And so we're excited to have our guest Mark Lefebvre here today with us. Mark, I've known Mark for a few years now. We first worked together on the Governor's Commission on Drug and Alcohol and Drugs Prevention Task Force, and now I see Mark and all the wonderful work he's doing in this community. Mark is the Recovery Program Executive Advisor at Pinetree Institute. He's responsible for the development and delivery of services for building community resilience against substance misuse. And he's been working in the Greater Portsmouth area. This has been really fun to follow the last number of years to start the Greater Portsmouth Recovery Coalition, as well as working on a youth coalition. So that's been fun to follow. And most recently, because that's not enough, his new podcast, It Takes a Village, invites us to have a conversation with him and his guests. And as they talk about hope and recovery, and they put a spotlight on the community's efforts on addiction prevention and recovery. So I'm thrilled to have you here today. Thanks for joining me.
Thanks for asking, Julie. It's great to be here today. It was great to see you yesterday at UNH, and thank you for the kind introduction.
Thanks. Speaking of that, you can see me walking around the Stratford County Addiction Summit yesterday. We did a little live Facebook Live there. You were probably eating your lunch, but I was walking around with my camera. So, Mark, tell us a little bit about your prevention story. How did you get involved in prevention?
That's a great opening question, Julie. So, as a point of introduction, I am a person in long-term recovery. And for me, that means that I haven't found it necessary to pick up a drink or a drug in almost 12 years. And so I've got some lived experience here. I'm also I've been trained by Dr. Robert Anda as part of the Pinetree cohort of master trainers around ACEs. So some of the folks that may be on this particular stream today may have been the recipient of training over the last 3 years from an individual, or perhaps even me, as it relates to adverse childhood experiences, and most importantly, having that knowledge of the correlation between, childhood trauma and downstream behavioral health, social issues, substance use disorders, and so forth. The prevalence of high ACEs score can lead to some of those issues. So I've been doing a lot of work on understanding how we can break that transgenerational cycle of passing ACEs and adverse childhood experiences from my generation on to the next generation. And that, in its purest sense, is perhaps one of the things that we can do as it relates to prevention. So that is front and center in my mind, and the work that we're doing around the Portsmouth Recovery Coalition and the Greater Portsmouth Youth Wellness Coalition certainly is an example of what we can do in the community to prevent, substance use disorder and mental health in our kids.
So how did you first get to Pinetree, if I can ask? I
Absolutely.
remember that you had a career, a different career previously.
So that's a great point. So first of all, the executive director of Pinetree Institute, Larry McCullough, Dr. Larry McCullough, and I have been friends. And I did a lot of work with him probably about 4 or 5 years ago. I've been with them for a little over 3 years, almost 3.5 years now. And so in 2017, I took an early retirement package from IBM. I have engineering education. I'm a math geek by education, and I worked in high tech for over 37 years, 22 of which was at the last 22 was at IBM. Um, but my journey through my own recovery connected me to a lot of wonderful people that we probably have a mutual relationship with, and that exposed me to a lot of different things, and I was moved as a result of my own lived experiences to kind of jump into this space as a second career. Some of you may know my wife Vivian and I and Sandy Coyle, we're the founders of Safe Harbor Recovery Center. So I got involved with Safe Harbor probably almost 10 years ago in terms of the business plan and reaching out to various community members to get support and get a location and financial support before FedCap took over and Granite Pathways took over. So I was involved with recovery for a number of years. And so Larry and I had a conversation about, how can we bring trauma training, ACEs training into the community so that we can start moving upstream from recovery into the prevention space. So that's what kind of led me to Pinetree. I joined Pinetree, like I said, about 3.5 years ago. The initial work that I did there was to build a coalition, to help build the coalition, which eventually morphed into what is now known as the Greater Portsmouth Recovery Coalition. Back then it was called the Portsmouth was it the Portsmouth Coordinated Response to Substance Use Disorder. So it was kind of a mouthful. And so Larry and I iterated on this model of a recovery ready community, and we applied it to Portsmouth. We've done some work in Southern Maine in the same space. And then I took over. My final job at Pinetree Institute was the statewide director for Maine's Recovery Friendly Workplace program. We finally got Recovery Friendly Workplace off the ground, modeling it after the New Hampshire model. So anyway, long-winded answer to how I arrived at Pinetree Institute.
All right, great. Well, thank you. And talk to me about ACEs and trauma. And just for folks who might not really know what those adverse childhood experiences are, just if you could give us just a high level.
So adverse childhood experiences, or ACEs, it's a numerical representation on the number of adverse childhood experiences a child could experience, whether it's in the home, primarily in the home, but ACEs, adverse childhood experiences, and trauma can also extend from living in a community that has, for instance, a high degree of homelessness or a high degree of violence and so forth. And also can be environmental in the form of a pandemic or an earthquake or a hurricane, those types of things. So all of that as a backdrop, Dr. Robert Anda and Vincent Felitti, they conducted a survey and studied the correlation between neglect in the home, violence in the home, a parent with an addiction or alcoholism. Perhaps a parent was incarcerated, their parents divorced, they were physically or sexually or emotionally abused or neglected in the home. And so from a score of 0 to 10, there was a correlation between high ACEs scores and downstream physical health issues, mental health issues, behavioral issues, acting out in the community in the form of crime, early pregnancy, smoking, all these different things that can lead to, a shorter lifespan. And the correlation between people with ACEs scores of 4 or 5 or higher can oftentimes lead to a predictor of downstream issues. And so what we learned through ACEs and the training that we received is that, yes, ACEs can be a predictor of downstream issues. However, what's predictable is preventable. So tying it back to the work that you all do, if we can prevent adverse childhood experiences in the home and counter that with what we call positive childhood experiences, that can offset the impact, and we can break that transgenerational cycle of adverse childhood experiences.
Yeah. And so we've got so many folks in the state and, that are working to prevent, number one, those adverse childhood experiences. And like, we can't prevent earthquakes or, like there's a lot of trauma that we can't prevent, right?
Mm-hmm.
And all hope isn't up if that happens, right?
Right.
So we know that, I hear what you're saying is that positive childhood experiences and positive experiences throughout, early adolescence and through young adulthood, all those positive experiences go a long way to mitigating, right? Reducing the impact of any of that
Exactly.
adverse childhood experiences that may have happened before we met this young person, before we knew about it, that
Mm-hmm.
were unavoidable, and that, if a parent had a substance use disorder, like it doesn't mean all hope is lost for their kid.
Correct.
Yes, that is a hard thing for that kid to have lived through, but it's like we can build that kid up from the home out, right?
We can, and it comes down to this notion of resilience. And resilience can mean a number of different things to different people and so forth. But for me, resilience means we equip the individual or the family or the community, whatever it is that we're focusing on in terms of offsetting trauma, by building resilience. And that can be in the form of a tool set or relationships or a mentor or a non-parental adult that can look after the welfare of the child in the community, having a strong school system, a relationship with teachers, a relationship with peers, kids having the ability to be heard, making decisions and feeling as though they're empowered. Those are examples of the things that we can do to offset and build resilience. And like I said, when we talk about resilience, we talk about capital, the capacity to withstand some of these challenges that come forward.
Awesome. Thank you. Wow, what a neat path that you've taken. So now you said that you are currently, you helped get that recovery ready, the community, Greater Portsmouth Recovery Coalition together, and also the Youth Coalition. So tell us a little what's going on there. What do those do, and what's the purpose, and how does that how do those two things benefit a community?
Okay, so I'll start with the Recovery Coalition because I'm closest to that, but I'll pivot to the Youth Wellness Coalition. One of the things I would like to mention, though, Julie, is that perhaps people don't realize that Portsmouth received a drug-free community grant. And the drug-free community grant is being integrated into the Greater Portsmouth Youth Wellness Coalition, which is a coalition that's comprised of a number of different organizations and sector leaders and school systems and so forth. And by Greater Portsmouth, we mean Portsmouth, Newcastle, Newington, Greenland, and Rye. Those are the communities that send their kids to Portsmouth High School. So that's what we define as Greater Portsmouth. So the Youth Wellness Coalition, which is led by Amy Michaels, who's the director of prevention programming at Pinetree Institute, they have, the coalition is comprised of youth. I mean, there's representation from youth organizations. There's representation from the school, Safe Harbor with its alternative peer groups and the work that they're doing at Safe Harbor, and a whole host of other organizations that provide programming and services that help lift the capacity for resilience for youth within the community. So I wanted to point that out straight away, that there's a drug-free community grant. It's the first of its kind in the Seacoast, and it's a 5-year grant with an option for 6 through 10 to raise the tide of prevention capacity within the Greater Portsmouth community. And so that's up and running. And like I said, Amy and folks can find way more information on that at www.pinetreeinstitute.org. On the Greater Portsmouth Recovery Coalition, this has been up and running, like I said, for about 3.5 years now, and it's morphed and evolved over the course of of those years. And it's built now on a framework of a recovery ready community. There's a tool set that has been provided from SAMHSA that allows communities to have access to what other communities across the country are doing to solve different issues as it relates to recovery. And so, for instance, best practices include outcomes, defining outcomes, and the ability to manage outcomes. It includes things like how to identify and do a needs assessment to identify what the gaps are for communities that are looking to build a recovery ready community. And so what we're doing is we're taking a framework, we're applying it and using as a case study what we're doing in Portsmouth, and we're advising other communities on the steps that they can take to become so-called recovery ready. So addressing things like recovery housing, addressing things like workforce development, coordination of services, co-occurring illnesses. So being able to provide training and support to mental health providers that focus primarily on mental health and perhaps don't focus as much on substance use disorder, and vice versa. So having a more holistic approach, because we all know in this space that there's a large percentage of people who are dealing with behavioral health issues that have substance use disorder issues, and like I said, on the opposite side of the coin, folks that might be dealing with substance use disorder that have a prevalence of things like depression and PTSD and anxiety and so forth. So there are a number of different facets to a recovery ready community model. And what we're trying to do here with Portsmouth is to get that learning and experience and share that outbound so that other communities across the state, across New England, and even across the country can learn from our experiences.
Wow, that's awesome. That is great. I think this sharing of information, I mean, is amazing to help. We're just all learning so much in this process in the last 20 years, and we're able to bring that to new communities and help new communities address things. And I'm thinking about how you were saying that you have helped Maine stand up a recovery friendly workplace initiative, which is based off of New Hampshire's, right? And New Hampshire, Liza Zarka, who was working on the New Hampshire one,
yep.
in New York, leading the efforts to do that as well. So it's very cool how our internet technology and we've been able to just share our information with other communities, and we can all benefit from the experiences.
And what we're trying to do at Pinetree, and looking downstream in terms of time, I'm building what I characterize as a set of best practices utilizing what we've done in Portsmouth. I have not yet been able to find a quote unquote industry standard on how to build a recovery ready community. So that is what I am writing and working with Pinetree. And we hope to establish a community of practice with technical assistance and tools and trainings and so forth for other communities that are interested in becoming recovery ready. That's what Pinetree does best. And so modeling it after what Eliza and the folks from New Hampshire did around Recovery Friendly Workplace, where her and Sam Lewandowski and the team put together a community of practice for folks that may not be aware of Recovery Friendly Workplace. There are now, I think, 28 states that have adopted some form or fashion of the New Hampshire model. And Eliza, and using the learnings from Sam and her team, have put together toolkits, back to work agreements, trainings for recovery friendly workplaces. And so that's our expectation, is that we're going to grow a community of practice around a recovery ready community. And by the way, recovery ready community encompasses prevention. If you look at the entire continuum, where you have prevention on the front end, you've got treatment and recovery sort of in the middle. And as you move to the right, you've got reentry or recovery supports. And, for instance, people returning from treatment, people who might be reentering society from with a justice involvement background. All of those elements are elements of a recovery ready community. So when we say recovery ready community, we by no means are excluding prevention. It's on the front end. And our intent is to put as much energy and focus upstream so that we can prevent people from coming into that continuum of care in the first place.
Oh, that's wonderful. Thank you. Mindful of our time here, I do want to leave us with asking you, you have a role in an organization, right? You have this structured role. I mean, not super structured. You're kind of doing all these wonderful things, and but it's a role in an organization that is dedicated to this work. We're not all there, right? We don't all get to do this, but it's for work, but it's important to us, and it does take a village, as you say in your podcast. What advice do you have for the people who are listening today? Like, what can we do when we step away from our computer and interact with the people around us? How do we take care of ourselves? Like, any advice for us, individuals, for preventing, substance use disorder, substance misuse, mental health challenges, or the people we love, or the strangers on the street? What advice do you have for us?
Yeah, so I mean that's a really great question, and I would start by finding a way to be connected and make a difference in somebody else's life, and it comes down to really just being kind. Which is really fascinating. I can't believe I'm even saying these words because, like I said, I have such a left brain, background in terms of engineering and math, and I like things to be logical and if then else type of approaches to what happens in life. But I've really kind of moved over to the other side intentionally. So I would say being connected, being kind, helping other people understand that the end of our story has not yet been written. And that's one of the reasons why I got into this space, because what I'm finding in my journey in recovery is that, yeah, life happens. All these things come up, whether it's trouble in the home or whether it's, the political climate that's out there, people doom scrolling on their phones and so forth. We can get really caught up in all of this negativity. And so from a prevention point of view, as it relates to the work that I do around ACEs, is find a way to make a difference, especially in a child or somebody in a youth, high school age or younger, be able to make a difference in that person's life through volunteering your time, getting involved in your community. The libraries that we have around us, they're always open to opportunities to have somebody come in and give a talk. If you've got some professional expertise that might be of interest or of value in your community, find a way to share that. And by sharing that, I mean, yes, on social media we can be visible and so forth, but to me, there's nothing that beats having a face-to-face connection with another individual. So being connected, make a difference in somebody's life, especially if they're of high school age or younger. Find time to mentor somebody, find time to contribute your skills and your expertise.
Absolutely. Yeah. The local Boys and Girls Club or the YMCA or at our childcare centers or at the high school.
Or if you're an outdoors person, lead a hike.
Yeah.
If you're an avid bird watcher, take a group of kids out to teach them, how to do the things that we grew up with, fly fishing, camping, take them to the skate park, all these different things that are out there. But, just make yourself available to be connected to somebody else.
Absolutely. And that's one of the, things that we have on the partnership at Drug Free New Hampshire of ways to get involved. And one of the, hugely important prevention strategies is mentoring, right? And then we also know that it's good for the mentor, right? So it's good for us, right? Because we benefit, and we hear that from mentors. We hear that from adults who spend time with younger people, that they get as much, they learn more. It's good for them as much as it's good for the young people that they're with. It just starts building that connection. And we know that our young people need it more than ever after that. I heard somebody say this the other day, I'm sick of talking about COVID, but I can't not talk about it because we're still seeing it. Absolutely. And we know that different communities, kids were out of school and more isolated than others. And so it's still a really prevalent
Mm.
there's a prevalent impact. It's that trauma you were talking about in ACEs. So, well, thank you for that. And we'll put your podcast in our chat as well. It Takes a Village, and it's hosted at the radio station. You
Yeah,
do it there.
WSCA, Portsmouth Community Radio. We have a podcast series, and that's also one of the things that I try to do is we bring younger groups in, and I'm teaching some folks how to podcast or how to do production in a radio environment, doing the underwriter, the community calendar announcements, and so forth. So that's one thing that WSCA is leaning into in a big way, is bringing youth into our radio station to help them get some youth programming. We hope to have kids come in and do their own radio shows and so forth. So, there's a lot of opportunity out there. But WSCA is sponsoring with Newburyport Bank and Pinetree Institute and the Willette and Furbish Fund. And what we're doing is 24 episodes in 2024 on topics that relate to addiction, prevention, and recovery on the Seacoast.
Yeah. Wonderful. And just that, like, I'm thinking about that with young people too, is like that skill development, right? They're learning a new skill, they're being supported, they're getting out of their comfort zone. Like, all of those pieces are so incredible. And then they're going to have a skill and something on a resume.
And it builds resilience. It builds resilience.
Yeah, it builds resilience. Yeah. They know they can do hard things. They know they can learn new things.
Mm-hmm.
So the next time they're introduced to something new, they're like, I can do this. I did it before. So all those are wonderful. Thank you for everything you do for the people in New Hampshire and our surrounding states. And we really appreciate it. And thanks for sharing it all with us today.
It's been a pleasure.
Appreciate your retired time.
Yeah. Well, thanks to everybody who's listening.
Yeah. And for those in the, that could be hearing us, please know, the Friends program in Concord has mentoring. You have your big brother, big sister. Those are sort of official places for mentoring. But like Mark said, your local community resources, the library, schools, after school programs, all of the, Parks and Rec, Audubon, all those places could have opportunities for guiding some young people. And if you can't find anything, reach out to the partnership. We're happy to help try to make those connections with people that we know. So thank you, everyone. We'll be here tomorrow with some New Hampshire Teen Institute alums who have gone through their programs and then are now involved in prevention themselves. And we are excited to talk to a couple of young people tomorrow. All right. Well, thank you all. Thanks, Julianne, for being our support in the background. And Mark, we'll see you on somewhere else soon, I'm sure.
And if people, I just posted another link to get into the podcast.
Oh, awesome. Perfect. All right. Thank you.
Thank you.